This is a routine nuclear sclerosis grade 3. I'm doing a phaco. I put in my incision, put in some HPMC, and as usual, I take my 26 gauge needle, bend 26 gauge needle, and perform my capsular rhexis, usually around a 5.5 mm rhexis, as is recommended. And going on well. That's it, that's done. Once that is done, go ahead, target to do a good hydrodissection, and you can see the wave going across, beautiful wave going across. In fact, it's also hydrodelineated as well. Just do another wave and yet another wave, just to make sure I have done a hydrodissection as well. Just repositing that nucleus back into its casing and then put in some HPMC and I'm good to go. Since the nuclear sclerosis is not great shakes, I take my dialer as a chopper and I am at around 50% phaco power, 400 millimeters vacuum and 40 ml AFR. And as I said, this is a very nice cataracted chop. So I think 4 segments will do really well. And without coming out of the AC, keep rotating and finish your chops in a jiffy. Since this piece did come out, I took it out. Normally I would do all the 4 segments first, but if a piece presents itself, I just knock it off. And that's the 4th segment. And once that's done, I proceed to remove all the pieces. Now this whole part is completely unedited, so you can see how I went about doing this surgery. I have now stepped down my aspiration and vacuum parameters. I am planning to take out this epinucleus, cortex, etc. with the phaco tip itself. And just watch how I am doing it. Always make sure you face your bevel downwards. Make sure you get enough of the cortex or epinucleus, whatever, occluding your phaco tip, and then strip it. Try your best to avoid taking it out piece by piece or fiber by fiber. Very difficult. And the sub-incisional part will be the most difficult, but if you can get hold of it, it should come off. And the other thing obviously is you have to avoid engaging the pupil. And there you can see, once I've got hold of it, patient is a bit apprehensive. It's okay, but I wouldn't advise a novice surgeon to try this. And now there are some fibers on the posterior capsule itself, and I have gone down to my capsule polishing mode, in fact lower parameters, and even that, you just watch how I'm polishing the capsule. It is doing it well, but look, it can engage the posterior capsule. Be very careful not to pull. In fact, I am only at 5 millimeters of vacuum and 5 ml flow rate. I don't think I can step down below this, although the flow rate you can step down further, I think, and that's what I'm going to do next time. See how it has caught the capsule. And that can be, if you are not careful, if you don't pull. Once it engages, don't pull. Just let go of your foot pedal and disengage that capsule. These single stringy fibers are the most difficult to remove. Anyway, I have done everything, nicely cleaned it, and then I suddenly notice, look at that hidden thief. He was hiding under my phaco probe all along. That's a small nuclear bit. And always check under your incision. That's it. I had to go back with my phaco probe and eat up that piece. Then under hydroimplantation, I'm injecting this single piece hydrophilic IOL directly into the back. I then proceed to put in my intracameral antibiotic, check my wounds, and conclude the surgery. Thank you so much for patiently watching.